People think that knee pain is inevitable as they age. That may not be the case. I'm Steve Messier. I'm in the Department of Health and Exercise Science at Wake Forest University. I've been at Wake Forest for 44 years, and I've been doing research on older adults with osteoarthritis for 34 of those years. Pain, especially in an older adult, but even in a younger adult that has osteoarthritis, pain can govern your life. We ask our participants sometimes where they live. I live in a house, I live upstairs and downstairs. What's upstairs? I don't know, I haven't been up there in a few years. Okay, so what happens is the pain changes your lifestyle. I mean, they have narrowed their lives because of pain. And if we can reduce that pain, we can give them a lot of their life back. Knee osteoarthritis is inflammation of the knee joint, and it's not just the bones that make up the knee joint, it's the soft tissue involved. And there are two pathways that this happens. One is increase in load on the knee joint, and the other is inflammation. Obesity, which is a major risk factor for osteoarthritis, impacts both of those. So what we do is to reduce the weight, reduce obesity, and that reduces the load on the joint, and at the same time it also reduces the inflammation. Osteoarthritis has been thought of for many, many years as inevitable. As I get older, I'm going to get osteoarthritis. Well, maybe that's not true. So over the last 3+ decades, our research team has found that, one, that exercise is better than not exercising as far as reducing pain, that the combination of a 10% weight loss plus exercise is better than either the weight loss alone or the exercise alone in reducing pain, improving function, improving quality of life, reducing knee joint loads, reducing inflammation. And now we're trying to take what we know works with people with osteoarthritis and trying to prevent that from happening in people who are at risk for the disease but don't have it yet. So what we're trying to do as a team of researchers is to improve people's quality of life, reduce their pain, improve their function, reduce inflammation, reduce the load on their knee joint, all these good things, right? And we're trying to prevent them from getting to the point where they have to have a knee replacement. So TOPS is a large study. It's international. We're recruiting people who are at risk for having knee osteoarthritis but don't have it yet. That is women 50 years old or older, and they have obesity. So what we're predicting is at least 30% fewer people in the diet and exercise group will have osteoarthritis after 4 years compared to the control group. So we're looking to see if we can actually prevent the onset of osteoarthritis through diet and exercise.